Normally you just feel some little pinpricks. Sometimes there's a little stinging, but that usually goes away pretty quickly. If you have a little itching at the end, then we may put a little bit of 1% hydrocortisone cream on. We'll want you to stay active. You don't have to limit that. Want you to wear the surgical stockings for about 3 days, taking them off every day to take a break. And basically nothing else that's really remarkable. If there's any unusual problems, then we'd want you to give us a call and we check things. Usually I recommend that most people come back for a checkup in 4 weeks or so, just to see if there's any areas that might need a little bit of additional treatment. Treating spider veins is always not wanting to be too harsh. We want them to gently go away, so we use a medium concentration of the medication. Not every single spider vein goes away with one injection. Usually we mention about 60 to 80% typically. Little pinpricks here. Spider veins in general are more common in women. It has to do with hormone changes and things, but there are some folks that it seems to, run in the family. Some people that have a lot of spider veins also have underlying varicose vein problems, and if they're having symptoms or have some larger veins, then we usually recommend further evaluation, including an ultrasound in some cases, to check for that. Everything's going great. You doing okay?
Fine, thank you.
Good. Now the veins will look kind of red and angry. That's part of the normal healing process. They go away when we put the medicine in, but there's a healing process which can take a number of days, and so they sometimes look a little worse before they look better. Some spider veins like you have can cause some symptoms. Some people even have burning and stinging, so treating them can sometimes help the symptoms too.
Okay.
And we like people to come back in 4 to 6 weeks for a checkup. If we are treating a different area than what we've already treated, then it could be sooner than that, but it's good to give it at least a month or so to see the results. Not every single vein goes away with one injection because we don't want to be too harsh, and we use a medium concentration of the medication. Does anything that we've done seem to hurt?
No.
That's good. We want it to be as painless as possible.
It's very gentle.
So we're done for today, and you did really well. It didn't seem to bother you very much, so I'm glad for that. The veins seem to respond well to the injections. We anticipate the majority of those will go away with one treatment, but we always recommend follow-up in 4 to 6 weeks to check the areas. If you have any problems, like something is real sore or something, feel free to call us at any time and we could check things sooner. It's rare that people have problems after this, but we are here to check things. So on the follow-up visit in 4 to 6 weeks, we would just take a visual look at the areas. If there's some areas that look like they may need a little bit of additional treatment, we'd be happy to do that. But that would be up to you. If we just do a checkup without any additional treatment, there's no charge for that visit.
Okay.
So we'll want you to wear those stockings for about 3 days, take them off every day to take a mild soap and water shower, then put them back on again. So a couple hours off a day. The bigger the vein, the more important it is to wear the stockings afterwards. These are all smaller veins, so we do want you to try to wear them, for the 3 days.